Hi again. I have this little microphone I bought. I don't know how well it works, but it's better than my phone's microphone. So, this video, I want to talk about why I needed a hip replacement. Um, I'll try to make it not so long so you can follow along. So, when I was 9 years old, I had something called a slipped capital femur epiphysis. Basically, the femoral head slipped out of the socket, and I had an immediate emergency surgery the very next day. I don't even know how I made it through the night, but the very next day I had a surgery and I had three pins placed in my, like around the femur head, and I had the femur head slipped back into the socket. So that I had at age 9. 3 years later, I had the pins removed, and um, I want to say by age 9, 10, 11, 12, at like around age 12, I started having um, stiffness, limited range of motion in my hip. Like I knew something was off, and I think maybe a year or two later, around age 15, my mom took me back to an orthopedic, and they said I was starting to develop arthritis, osteoarthritis, OA, and basically treat it with Tylenol, ibuprofen. Um, Nothing really they could do at that point. It was just the starting of our osteoarthritis, and then they started to notice what they call dysplasia, is when you start seeing deformities in your hip. Um, and so as the years progressed, it got a little bit worse every year. Just more stiffness, definitely less range of motion. I think since age 12, I wasn't able to tie my shoe anymore. I couldn't, yeah, do those movements that you need in order to tie your shoe to really slip on your socks. I got really creative with that one, and I was able to do it. And if you're a parent and you're dealing with a child with uh, slipped capital femoral epiphysis, also known as SCFE, if you're dealing with that and you want to know more about my journey with that, feel free to comment and I can make another video about that. But this is just a quick kind of history of what led to my hip replacement. So, fast forward to um, a couple years ago after I gave birth to the fourth child. Um, I started noticing increased pain with walking. I'd be okay for like a few weeks, and then I'd start walking one day, and I'd notice stabbing pains in my hip. Um, and then it became more frequent. If I went and walked for like, I don't know, half a mile, like the next day I'd be really sore and a lot of pain, just popping pills. And by that I mean like Tylenol, ibuprofen. And just something didn't seem right. So I went to an orthopedic walk in, and they told me, yeah, that basically um, I had moderate osteoarthritis of the hip. They showed me my x-ray. They showed me how deformed my femur had become. If you guys are interested, I can upload a picture of those x-rays. But basically saying this is what it looks like. You're basically going to need a hip replacement, but you're so young. Most surgeons won't want to do it, but we'll refer you to a surgeon and see what they say. And so I was referred to a surgeon. My symptoms kept just getting worse. I went and saw the orthopedic surgeon that they referred me to, and basically he said, it looks like your only solution is a hip replacement because your arthritis is going to get worse. Your deformity is you just it's very deformed. Um, and but you can't just get a hip replacement. Insurance won't just give you a hip replacement, won't approve you for one. You're going to have to get some cortisone shots and try that for and you're going to have to go through physical therapy. Basically, you're going to have to manage the pain to the point where it those to a point where that's it's not effective anymore. To get the shots done, to do physical therapy where that's not helping anymore, you can prove to insurance that you've tried all these things and nothing's worked, and hip replacement is the last resort. and we don't like to do it on young people like you, is what I got. Um, so I went home. I was disappointed. I made a bunch of calls trying to get those appointments um, to get those cortisone shots, and no one really returned my call at this clinic. I kind of gave up and just dealt with it. Physical therapy, honestly, it didn't work with my schedule. So I just kind of try to YouTube videos of what could help and try to do that at home. Um, I'd have moments where I felt better, like, oh, I can deal with this, and I just lived my life as best I could, and I noticed just things progressively getting worse. Like I used to be able to go out and walk for at least a mile, and I felt good. I used to be able to jump on the elliptical and do that, and the treadmill. Um, I think by the end of that year, when everything all started, I could no longer use an elliptical. Like if I did an elliptical workout even like 10 minutes, stabbing pains the next day, flare-ups. If I walked anything that involved like an up incline, like an uphill incline, uh, flare up. If I did any kind of a like walk past maybe a quarter mile, a flare up. It was awful. I couldn't keep up with my kids. My quality of life just sank. Everything was like our family vacations, our family outings, everything was had to be planned around my hip. Um, Car rides became very uncomfortable. After like a long car ride, I was on painkillers for like the next couple weeks. I just started to decline very fast until one day I went on a short walk with my child in his stroller. And by short, I mean like around the block. And I felt something like a really, really sharp pain where I couldn't put weight on my hip anymore. And I was scared. I was like, something is wrong. Like, something is not right. And I had to get my husband to take us home, pick us up. And I thought, okay, I just need some rest, take some medicine. Like, I've had flare-ups before, never to where I can't put weight on my hip. But I nothing was helping. I couldn't put weight on my hip, and I was like that for 3 days. I finally thought, like, okay, maybe something awful just is going on, and I need to go check it out. So I did go to the ER and did an X-ray. They're like, well, it's just the same thing I've been told before. It's just you have um, osteoarthritis, you have deformity, your cartilage is looking pretty low, and they asked me like, would you like to be referred to a surgeon? And and then they sent me home with oxycodone for a few days, which didn't really help much at that point. And I said, well, I need to do my research on a surgeon, and I'll get back to you guys for the referral. I I think I looked at my insurance, and they didn't take the place I had been to before, where the doctor's like, "You're too young, you have to do this, this, and that." So started looking at other surgeons. I called two places, and those places said, "If you're under 40, like the surgeon won't see you. They don't see patients under 40." And that was so discouraging. I remember crying. I remember just laying in my bed and just and sobbing because I couldn't put weight on my hip. I couldn't walk. My husband was taking time off work. My children wanted to do things. I couldn't be a mother. I couldn't be a wife. It was miserable, and I was just crying and like, what is going on? And I heard of another surgeon that also took patients under 40. I mean, over 40 only. And I thought, it's worth a shot. I'm just gonna call, explain my situation, explain I'm not your typical case, and see if they'll see me. So I did. I called, and I explained my situation. I said I cannot put weight on my hip. I'm in a lot of pain. No one is willing to see me at this point because of my age, but I really need to be seen. Like, it's important. Like, I can't live like this. And I think the secretary was moved, and she had a talk with the surgeon, and he was willing to see me. And so I remember I stayed up that night before my appointment. I stayed up late just gathering every thought that I could think of, like every reason why they should help me out. They should consider a hip replacement. I gathered all my x-rays, all my um, like X-rays from when I was a kid, my recent ones, um, and I stayed up rehearsing what I was gonna say, and for the very first time, I went into the office, saw the surgeon, and I felt heard. I didn't feel dismissed. He understood how it was affecting my quality of life, and I really felt like he was a parent also, young kids, and so I felt like that's where it got him, like, okay, this person's around my age, and he even said, "You're about my age." And he it probably, sank in like, "Hey, like, this is how she's living her life, and she's about my age." And I think he felt compassion for me because he put himself in my shoes, and he's like, "Look," he's like, "If I were you, I'd wait till your kids are older and do it, but if you wanna go ahead and do it, I'll do it." And I said, "I wanna do it. Like, I don't wanna wait. My kids are young, but I can't be there for them, like, I'm missing out on their best years." Um, and so we agreed to do it, and he went over um, all the risks and the benefits, and he said, "So one of the risks is that your one leg might be shorter than the other, most likely the or longer than the other, either or." He's like, "With surgery, like, we're not always exact, and that's one of the risk factors is that one of your legs can be shorter than the other." And he said, "My guess is with your hip already being shorter than the good hip, that it might be shorter after surgery as well, and we can revisit that later with shoe inserts. But most likely you might need a shoe insert." And I went home that night and I just felt relief. Like I felt like, yeah, like someone finally understood where I'm coming from, um, even at my age. And um, yeah, I just felt heard and understood. But then later that week, I I started thinking about like the whole leg length, and I didn't know that was a thing. I didn't know what the risks were before going and seeing the surgeon. And then I also looked at my discharge paperwork and noticed that they never even took like a height and weight, and there was like so much information on there. Um Not my discharge information, but like the information sheet I got on my way out of the doctor's office, and they didn't update anything, and I thought, well, that's odd. Um and then as I scheduled the surgery a couple weeks from then, and also they got it approved by insurance. I didn't need to get physical therapy and injections like the first doctor had said, by the way. So don't always trust that. Um, as the PA told me, his assistant told me, there's workarounds. Your hip is pretty bad. Like insurance pretty much can't argue. Um, so there was no need for that. Like he's like, "Don't even worry about getting it approved. It's gonna get approved." So they scheduled it, and they scheduled it for an outpatient surgery center, and they said, "You're gonna go home, and you're probably just gonna go home walking with your cane. You don't need to do physical therapy." And so I started doing a whole bunch of research, and I was reading that physical therapy is actually recommended. They do recommend it, and it's very helpful after a hip replacement. And then I was also reading that most surgeons try their best to have your legs even. A good surgeon will try his best to have your legs be even. So the whole like my hips not being even afterwards, I understood, it's a risk, but the doctor didn't seem very confident and reassuring that he'd try his best. And then what else made me feel uncomfortable? There was something else. Just like all the outdated information that they didn't update. Um, and then the outpatient center, which is great because when you have your surgery at an outpatient center as opposed to like a hospital, you reduce chances of like infection, like being in a hospital with a lot of people and everything. But the idea was to send me home that same day, and usually I don't do well with anesthesia and from past surgeries, so I was a little bit hesitant on being sent home the same day. So I don't know. All those things were like weighing in my head, and I started doing research on like leg length discrepancies during hip replacements, like how often they happen. And I read a whole bunch of horror stories, and I was getting scared and nervous. But then I came across Someone said their surgery was robotic, and that the robotic surgeries, they kind of improve that outcome of the discrepancy. And so that got me digging into robotic surgery, like robotic assisted surgery. And I found a doctor, a surgeon, um, also in that same area, and took my insurance. And he was skilled with the Mako robotic system, to help in hip replacements. And so I thought, and then I also read that a lot of people, they interview multiple doctors. So I thought, okay, well, I have this surgery scheduled, but I'm not 100% confident this is the right doctor. So I took another shot, took my same notes to him, and I went and saw this other doctor. And I explained my situation. I told him that my quality of life was awful. By this point, like, I could put weight on my hip. It was just like I got better, but I knew I was just days away or moments away from another flare up where I wasn't going to be able to walk anymore for a while, at least, hopefully. And then, and I told him my situation, everything. He listened to me. He gave me like all the time in the world, it felt. He answered all my questions. He explained what they use as far as implant materials, um, and pretty much how he does the surgery, how he uses the robot to plan for it, how how that can help minimize leg length discrepancy. And I felt so comfortable with him, and I just knew, like, my gut said this is the one. And I said my the other doctor I saw said that there would most likely be a discrepancy with my legs, like my operated leg being shorter than the other. Is that something you think will happen as well? And he said, "Are you sure?" He said that, and I said, "Yeah, I'm sure." He said, "I'll do everything in my power to make sure your legs are even, and with the robotic system, that'll help me even more. I don't anticipate your legs being different." And so that was just the cherry on top, and I felt 100% comfortable. I felt like this is the doctor, this is the one. I just had that gut feeling, and I called the other clinic. I canceled. I scheduled with this new doctor, and I think when you're looking for a doctor, don't settle. Like, I'm part of a Facebook group, and I'm constantly hearing stories about different things happening to people. Don't settle for a doctor you're not, even if you have some doubts, if you're not 100% sure, don't settle until you're 100% sure, where you feel comfortable, you feel heard, um, you feel like the doctor's knowledgeable enough. Like, really do your research, and don't just blindly go in to a surgery without really knowing much about the doctor, about just, you know what I mean. Just be sure you feel comfortable with who you choose. And so I guess this is video is becoming longer than I expected, and hopefully it was helpful in some way. If not, sorry, but yeah, like I said, it's slipped capital femoral epiphysis is what led to this, um, osteoarthritis. And yeah, so basically, by the time I was approved for surgery, I had um, a CT scan. Oh, by the way, this doctor ordered a CT scan. The other doctor was just going to go based off an x ray. CT scan showed severe osteoarthritis. It showed very thin cartilage. In some areas, it was bone on bone, which is probably where I was feeling that stabbing pain when I was walking. And it also showed dysplasia, so the femoral head deformity, and then a shortened stem. I'm not a doctor, but there was a lot of issues basically. And I was having also pain in my good hip, because my good hip was having to compensate so much. But yeah, so that was it. That was the deciding factor, and that concludes this video. Um, Keep watching. I'm gonna make upload another video where I talk about surgery day.